I come into work every day and I feel really rewarded that I am in fact making a difference.
We take care of the poorest people in the city, and with all the changes in the healthcare system, we don't want our patients to lose. We don't want HHC to lose funding, so we're here to help.
I love taking care of the elderly because they built this country and they deserve the respect back.
I would love to stay this job because I love helping people. I really do care for people.
I am one of those people that went into nursing to help people, and I still feel that way. I still have the people connection. Everyone is my patient, my sister, my friend, or my neighbor.
As healthcare workers, we're driven to help others and provide the highest quality of care. Our day-to-day work is always changing, and the same is true for our transforming healthcare delivery system. Given the complicated and rapid changes taking place, it's more important than ever for us to look forward and to have a voice in shaping the direction of healthcare for those we serve. Our experience and knowledge are needed to make sure that changes improve rather than harm our patients, our clients, and our communities. Recent healthcare reform has shifted how hospitals and doctors are paid. Instead of getting reimbursed for the number of procedures they provide, they're now paid to provide quality services. In other words, the healthier patients are, the more money everyone makes. This changes everything about where people get their care and who provides it. The days of the community hospital are disappearing. Instead, mega-regional healthcare corporations are controlling access to healthcare for our communities.
Governor Rauner wants to balance the state budget on the backs of low-income children.
Too often, this includes closing facilities in communities of color, where decades of racist policies and politics have created environmental and public health problems that have left a legacy of asthma, diabetes, and other chronic health problems. We need to be doing more to meet the care needs of the 10,000 people who turn 65 every single day. This explosion of aging adults and the desire for seniors and people with disabilities to get care and live independently in their own homes is occurring at the same time there is a dire shortage of long-term care workers. Low wages and a lack of benefits make home care a job too few can afford. Technology is completely transforming the way care is delivered and received. Mobile phone apps are now allowing families to order a house call by a home care attendant or primary care doctor. Patients, family members, and providers are utilizing telemedicine services, even robots, to assess symptoms, recommend treatment, and share health data. For the most part, healthcare corporations are faring well, with many making record profits, even as costs for our families continue to rise. In fact, 4 major healthcare companies are on the list of companies, alongside McDonald's and big banks, that have the biggest gap in pay between the CEO and frontline workers.
I'm working here in Fargo for almost 20 years. I'm not even $14 yet.
While more Americans have health care coverage than ever before, thanks to the Affordable Care Act, extremists are undermining the law with repeated efforts to roll back progress.
Obamacare is a disaster.
The best interest of the country would be achieved by pulling out Obamacare root and branch.
Meanwhile, 19 states are still holding out on Medicaid expansion.
Nearly 1 million hardworking men and women could get health care if the few arrogant elected officials would let the House of Representatives vote on accepting Medicaid expansion in the state of Florida.
These attacks don't end with Obamacare. For years, we have faced unprecedented corporate-funded attacks that divide our communities and weaken the power of workers by taking away union rights. Extremists even turn their sights on home care workers in the Supreme Court case Harris versus Quinn.
We're going to the Supreme Court to
lobby and to tell our stories.
At times, it seems that the turbulent, ever-changing times we're living in are more than we can possibly handle.
Home care for me is a lifeline. It's a lifeline to the rest of my life.
But that hasn't stopped us before, and it won't stop us now. We've already started organizing in different ways so we can meet these challenges and identify new opportunities. As the largest union of healthcare workers, SEIU members are fighting and winning to have a voice and take our seat at the table in our work, in the healthcare system, in our communities, and beyond. Workers all over the country are joining together to build a movement for healthcare justice. We are SEIU Healthcare. We are unstoppable.